Good morning. My talk is titled Geographic and Temporal Variations in Community Antibiotic Use in Florida from 2010 to 2012. So in 2013, the Centers for Disease Control released a report titled Antibiotic-Resistant Threats in the United States. This report identified antimicrobial resistance as one of our most serious health threats. Each year, almost 2 million Americans are sickened by bacteria that have become resistant to antibiotic treatment. Antibiotic use is the single greatest driving factor for the emergence of antibiotic resistance, and previous studies have shown us that up to half of all antibiotics that are prescribed are inappropriately or unnecessarily done so. This report also identified several gaps related to our knowledge on antibiotic prescribing in the community. One of these gaps is that data on outpatient antibiotic prescribing is not readily available. We sought to address this gap by determining temporal and spatial variations in outpatient antibiotic prescribing in Florida, specifically assessing healthcare provider and patient characteristics. To do this, we obtained 24 months of retail and mail order antibiotic prescriptions for Florida and assessed the per capita antibiotic prescribing by Florida County, and specifically looked at seasonal and temporal variations within those provider characteristics. We found that on average 15 million antibiotics are prescribed each year in Florida. This graph displays the per capita antibiotic prescriptions by age group for 6 of the major antibiotic categories, as well as the total. Consistently, we see that children aged 1 to 4 had the highest per capita rates of antibiotic prescribing, nearly double the state average, equating to almost 2 antibiotic prescriptions per child per year. When we assessed the seasonality of antibiotic prescribing, we saw seasonal peaks for certain antibiotics, including the beta-lactams and the macrolides, which are common treatments for upper respiratory infections. This usage increased during October to February, which coincides with cold and flu season each year. Additionally, we found little to no seasonality with other antibiotics, including the tetracyclines and fluoroquinolones. When we assessed antibiotic prescribing by healthcare provider, we saw that the large majority of antibiotics are prescribed by general practitioners and pediatricians, 42% and 15% respectively. Last, when assessing the per capita antibiotic prescribing rates by Florida counties, we saw specific counties with high rates of antibiotic prescribing highlighted in red. These counties fell into north central Florida and the Panhandle. Overall, these results highlight some communities as well as provider groups which may be targeted in the future with direct public health messaging and education to reduce unwarranted antibiotic use. Future studies that we are planning will assess the association between high rates of antibiotic prescribing and high rates of antibiotic resistance within Florida counties. Thank you.